Being admitted to hospice. What to expect and know. Real stories from hospice nurses and doctors. Let me talk to you about something that many people don't fully understand until they are in it. Hospice care admission. Now in this video, I'm going to walk you through what actually happens when someone is admitted into hospice care. But not just from my perspective. I'm going to share insights and real explanations from experienced hospice professionals who have spent years, even decades, working with patients and families during some of the most sensitive moments of life. First, let's start with Nurse Julie. Nurse Julie is a well-known hospice nurse who has spent years working directly with patients entering hospice care. Her experience comes from being on the front lines, going into patients' homes, guiding families, and handling admissions personally. She explains what actually happens step by step during a hospice admission. And I want you to really listen closely to this, because this is where most of the confusion usually begins for families. Now let me explain something to you before I continue with her words. A lot of people think hospice just starts, like you sign up and that's it. But what she's about to explain is that there's actually a full process, and it's very detailed, very intentional, and very structured. Nurse Julie explains, first of all, I want you to be aware of the referral process. You usually get a referral from your doctor. However, I want you to note that you do not have to. If you or someone you love thinks they might be appropriate for hospice, you can always self-refer. Also, for hospice admission, sometimes a hospice nurse will handle the admission. Sometimes a hospice social worker will do the admission, and sometimes a hospice liaison will have you sign paperwork before you actually get to the admission. Please know that it will vary depending on the agency you end up choosing. Now let me pause right here and explain this to you. What she just said is very important. You don't always need a doctor to start this process. That means families actually have more control than they think. Also, notice how she mentioned that different people might handle the admission. This tells you that hospice is not a one-size-fits-all system. It depends on the provider. She continues, so, for a hospice admission, when I go into a patient's house as the hospice nurse, I usually have already been able to look you up in our computer system to get an idea of what's been going on. Some nurses have access to that information and some don't. If they don't, the things they go off are basically the diagnosis provided by the doctor or from the referral. Then, when they arrive, they'll start asking you questions about the diagnosis and other things that have been going on health-wise in your life. Now, if you have a nurse like me, someone who already has that information, I usually try to look it up and write it down in my notebook. That way, when I get there, I have a good picture of what's been going on with you. This includes not just your terminal diagnosis and why you're coming onto hospice, but also any other health conditions you might have. What she's describing here is something very real. Sometimes the nurse already knows your history, and sometimes they don't. So when they start asking a lot of questions, it's not random. It's because they are trying to build a complete picture of your health, your condition, and your needs. She continues, so at the admission, the important part is me, the hospice nurse, making sure that you're appropriate for hospice care. You're not necessarily getting approved at that admission. I, the hospice nurse, will be doing an evaluation to make sure you're actually appropriate for hospice. Not every hospice admission that I go to results in me admitting the patient onto hospice, because they may not be appropriate. I have to look at their diagnosis, discuss it with the doctor, and gather all the necessary information. Based on that, the person either meets the criteria to be on hospice or does not. Now, this is something a lot of people don't realize. Just because someone is referred to hospice does not mean they are automatically accepted. There is an evaluation happening. And this is important because it ensures that hospice care is actually the right level of care for that person. She continues, and the other part of that is that you, the person coming on to hospice, or your family member or loved one who is helping you, have to make sure that this is what you want. So the whole idea of this admission is to make sure we're both on the same page, that I answer all your questions and that you answer all of mine, so we can determine if it's a good fit. So when I'm doing a hospice admission, I always explain exactly what hospice is. To me, hospice is about living. Most people think it's about dying. I think it's about living. And this right here is one of the most powerful things she said. A lot of people associate hospice with death, but from her experience, it's actually about how someone lives during that time. Before I continue with Nurse Julie's words, let me explain something to you. What she's about to break down now is what hospice actually provides versus what changes when someone accepts hospice care. This is one of the biggest turning points for families because it shifts expectations completely. Nurse Julie continues, I try to explain to you how hospice works. Hospice is a Medicare-funded program, meaning all hospices nationwide in America should basically function the same. Medicare is our boss, so I explain to you what Medicare says we are allowed to provide to you, the patient who is coming on to hospice. So basically, Medicare says, hey, we're going to give you this whole hospice benefit over here. You get all of these things, which I'll get into in a second. But because you're signing up for this benefit, which is technically free through Medicare or your insurance, you will lose some things over here, and this is the part I'll get into as well. Let me pause here and explain this clearly to you. What she is saying is that hospice is not random. It is actually regulated and structured under Medicare. That means there are specific benefits you gain, but also certain treatments or options that change when you enter hospice care. This is where a lot of families get confused or even scared. She continues, so what do you gain from hospice? You gain a hospice company that is going to be available to you 24/7. A nurse cannot usually be in your house 24/7, but we are available to you. This means you can call us 24 hours a day, 7 days a week, and we can talk to you about what is going on. We can also send a nurse out to you if needed. So at 2 in the morning, if you call us because your loved one is suddenly confused or suddenly has more pain, you call us, and a nurse can come out. Now let me explain why this is so important. This is one of the biggest differences between hospice care and regular medical care. Instead of waiting for appointments or rushing to the emergency room, families now have direct access to support at any time. This alone brings a huge sense of relief. She continues, also, what we give to you is a team of people. This team generally includes the hospice doctor, hospice nurse, hospice social worker, hospice chaplain, and hospice certified nursing assistant, CNA. There are also other people who may be part of the team, such as volunteers, physical therapists, or even music therapists. It just depends. That team of people is going to be your team, your helpers, and they will be visiting you week by week. Let me break this down for you. What she is describing is not just one nurse. It is an entire support system. This is something many families do not expect. They think hospice is just a nurse checking in, but in reality, it is a whole team working together to support the patient and the family emotionally, physically, and even spiritually. She continues, so, the standard number of nursing visits at the lowest level would be once a week. The nurse would come out and check on you. If you are having a good week, they will come once and then see you again the following week. However, if things are going wrong, if you are having issues, if you are having a bad week, or if medications are not working, they can increase visits to every day if needed. We can escalate care depending on what your symptoms are. Now let me explain something very important here. Hospice care is not fixed. It is flexible and responsive. If things are stable, visits are minimal. But if things change, care can increase immediately. This is what makes hospice feel more personalized and adaptive compared to traditional care. She continues, the social worker and the chaplain are two huge parts of the team that I feel are often underutilized by families. When a family hears the word chaplain, they may feel turned off because they are not religious, or because they already have a priest, pastor, or chaplain through their church, which is completely fine. However, this person is a trained professional who helps with emotional and spiritual issues during the end-of-life process. They are not there to convert you to a specific religion. They are truly there to support you and your family. Let me pause here because this part is very deep. A lot of people misunderstand the role of a chaplain. It is not about religion. It is about emotional and spiritual support during one of the most difficult times in life. Many families do not take advantage of this support, even though it can be incredibly helpful. She continues, the hospice social worker can help with many things, including family dynamics and financial issues, which are two of the most common concerns. However, I feel that the social worker is also underutilized. If you are ever unhappy with how the care is going, or how your brother is acting when he comes over, you can utilize the hospice social worker to plan a family meeting. They can help everyone get organized and address issues that have not yet been discussed. Let me explain this in a real way. Hospice is not just about the patient. It is also about the family dynamics around the patient. Tension, stress, and disagreements can arise, and the social worker helps bring structure, clarity, and peace into those situations. She continues, also with that team, this hospice benefit that you receive includes supplies, which I will go into later in this video. You will also receive equipment and medications from us, which I will explain in more detail later. All of these things are included in the hospice benefit. Now, let me explain why this matters. Everything she's mentioning, supplies, medications, equipment, reduces the burden on families. Instead of trying to figure everything out alone, hospice brings the resources directly to you. She continues, now over here, things you lose if you sign up for hospice. I hate using that word lose. I want to make a clear distinction here. If you sign up for hospice, you do lose part of your benefits. So the things you can't do on hospice, you cannot receive chemo or radiation for your terminal illness. Usually it's cancer, terminal cancer, you're usually on chemo and radiation, but now you're going to be stopping treatment and transitioning to hospice. So you can't do both. Let me pause here, because this is one of the hardest parts for families to accept. What she's saying is that hospice involves a shift in focus, from trying to cure the illness to focusing on comfort and quality of life. And that shift can be emotional, because it changes how people think about treatment and hope. I'm going to pause here again to keep everything structured and detailed, just like you asked. All right, let's continue. Now we're getting into one of the most important and often misunderstood parts of hospice care. Before I continue with Nurse Julie's words, let me explain something to you. What she's about to talk about now is what happens when it comes to hospital visits, emergency situations, and the reality of being on hospice. This is where many families hesitate, because it feels like they're giving something up. But there's more to it than that. Nurse Julie continues, now, I will say, every once in a while, someone will still continue to receive radiation because it's a palliative treatment. So it's basically radiation or chemo to help shrink a tumor or something to make you feel better. That kind of treatment you can still do, but if it's anything that's curative, you cannot do it. You are no longer supposed to go into the hospital. So if you call 911 and go into the hospital while on hospice, and you get admitted, you would automatically be taken off hospice. You can't do both, so that is something you lose. Let me explain this clearly to you. What she's saying is not that all medical help stops, but that the goal changes. Instead of aggressive treatments meant to cure, hospice focuses on comfort-based care. And because of that, hospital admissions are generally avoided unless absolutely necessary. She continues, now, when I'm at an admission, this is literally what I'm saying to the people I admit. I say all of what I'm saying now to them, and I always say, you're not stuck at home. You don't have to stay on hospice. If something happens, God forbid you fall and break your arm, we are going to say, go to the hospital, get your arm fixed, and then you can always come back to hospice if you choose. But in general, the whole point of being on hospice is so you don't have to go to the hospital. Now, this is very important for you to understand. Hospice is not a trap. You are not locked into it. If something happens, you can still go to the hospital and even return to hospice afterward. The purpose is simply to reduce unnecessary hospital visits and keep the patient comfortable in a familiar environment. She continues, so you don't have to continue to do that. There are many things we can still do here. We'll still start antibiotics if we think you have an infection. If you're starting to have new symptoms, we will treat those symptoms. So there are a lot of things we can still do for you. Let me break this down for you. A lot of people think hospice means no treatment, but that's not true. Treatment continues, but it is focused on comfort, relief and quality of life, not cure. She continues. After I say that whole explanation to the patients and families I'm working with, I usually get their opinion to see if this is what they thought it was going to be, and if this is what they want. If they say yes, and it's a good fit, and I think they are appropriate for hospice, and I've talked to the doctor and completed all the necessary steps, then we'll sign paperwork. You have to sign this paperwork because, like I said, it's a Medicare, federally funded program. In order for me to actually check you out and do a medical assessment at that visit, I have to have the paperwork signed. So we'll go through all the paperwork, get that signed, I'll leave you copies, and then once that's signed, you're officially on hospice. Let me explain this part. This is the moment where everything becomes official. The paperwork is not just a formality, it's what allows the hospice team to begin providing full care, support, and medical oversight. She continues. So now I'm the nurse who is first there at the admission, so I can do the full physical assessment. We can review all of your medications, I can order new medications if needed, and I can also order supplies and equipment. So that's the next part of the admission. Now, if you haven't noticed, this actually takes a while, right? Usually, admissions can take up to 2 hours because there is a lot to review. And hopefully, you have a lot of questions that I can answer for you. Let me pause here. This is why hospice admissions are not rushed. They can take up to 2 hours or more because this is where everything is set up, medically, emotionally, and logistically. She continues. So during the assessment, I personally do a full head-to-toe evaluation. I listen to the lungs, check the heart rate, and assess all vital signs. I examine your hands and toes, and I also perform a neurological assessment. I check everything thoroughly. I assess the skin from head to toe to make sure there are no hidden wounds anywhere, because those are common at the end of life. Pressure sores can start to develop since the skin is an organ too, right? So the skin is shutting down as well. Let me explain something important here. This is a complete medical evaluation. Nothing is overlooked, from breathing to skin condition, because at this stage, even small issues can become significant if not addressed early. She continues. So I'll do a full head-to-toe assessment. I'll have you take out every single medication you're on, even over-the-counter medications. So if you're taking a lot of Tylenol or vitamins, every medication you're on, even if it's as needed, I have you bring it all out and we review it together. I also go over the medications with the doctor, and we will carefully decide what you should stay on and what you should discontinue. Now let me explain this. This is where medication simplification happens. Instead of taking dozens of medications, the focus becomes, what is helping? What is unnecessary? What improves comfort? She continues. It's also up to the patient. If the patient says, I am sick of taking all this medication, we will work with you so you don't have to take it. We always advise continuing medications that help with symptoms. Let me pause here. This is about patient choice. The patient is not forced. They are guided, supported, and respected in their decisions. She continues. Then I'm going to listen to what your main symptoms are. Do you feel like they're being managed? Is your shortness of breath okay? Is your pain okay? If it is, we're going to keep everything as it is. If it's not, I'm going to call the doctor and we're going to work it out and get new orders in place. This is where care becomes personalized in real time. If something isn't working, it gets adjusted immediately. She continues. This is also the time when I'm going to be ordering the comfort pack. Most hospice companies will order something called the comfort pack, which contains just-in-case medications. I'll order that for you and all of the medications should be delivered. You do not have to go to the pharmacy any longer. Let me explain this clearly. The comfort pack is one of the most important tools in hospice care. It ensures that when something happens, you're not scrambling, you're prepared. She continues. Also, please take note that you can still continue to have a primary care doctor. You will have a hospice doctor, but you can still keep your primary care doctor if you choose. This means continuity is still there. You don't lose your doctor. Hospice simply adds another layer of support. We're getting deep into the process now, and there's still more to cover, especially equipment, safety, and final guidance. All right, let's continue. Now we're moving into the final and very practical part of Nurse Julie's explanation. This is where she begins to talk about the real-life setup inside the home, safety, equipment, and the final conversations that happen before she leaves. Before I continue, let me explain something to you. Everything up to this point has been about understanding hospice and getting medically prepared. What she's about to describe now is about making sure the environment itself is safe, supportive, and ready for what's ahead. Nurse Julie continues. The other things I'm going to order at this visit include equipment. I'm going to talk to you, as the patient and the family, about what you think you need. I will also be checking your home to make sure it looks safe to me. I usually ask which rooms you spend the most time in, and then I assess whether those areas appear safe. You don't want loose rugs around because falls are a huge issue at the end of life. You want to have lights on, or at least some lighting during the night, just in case someone needs to walk back and forth to the bathroom. Let me explain this part clearly. This is something many people don't think about. The home itself becomes part of the care plan. Things like rugs, lighting, and movement inside the house can become serious risks. So hospice doesn't just treat the patient, it also helps prepare the space around them. She continues, I think it's important to have equipment there. It's easier to care for someone if the equipment is there. So the things we normally order are a bedside commode, a shower chair, a hospital bed, and we can order a Hoyer lift if we need to. That's if someone is bedbound. That will really help. Wheelchairs, walkers, all types of things. So we can order those things for you. You just work with us and we'll order as much or as little as you need. Now let me break this down for you. This is where hospice becomes very practical. They are not expecting families to figure it out. Instead, they provide tools that make caregiving safer and easier, not just for the patient, but for the people taking care of them. She continues, this is also the time where we can order oxygen if we need to. I do think oxygen is over-ordered, just a side note, but we can do it. Now, supplies. Every company is going to be different, but Medicare basically says what we are allowed to order and what we aren't allowed to order. I usually order stuff like gloves, bed pads, wipes, briefs, lotions, creams, anything for wound care if that person needs it. Let me explain something important here. All of these supplies might seem small, but they make a huge difference in daily care. Without hospice, families often have to go out and buy these things themselves. With hospice, much of it is provided and coordinated for you. She continues, now, if the person already has something like a Foley catheter, an ostomy bag, or a wound, we can order all of that stuff as well. So all of those things will be supplied through us. Now, things we don't do or don't order are things like PureWick. We don't order specialty items on hospice, unfortunately. So what she's saying here is that while hospice provides a lot, there are still some limitations. But even then, families still have options if they want to get additional items on their own. She continues, after I'm done ordering all of these things, I will of course ask you if you have any questions. I always try to do that during the admission, but I also, before I leave, ask, do you have any more questions? I know I hit you with a lot today. Is there anything that I haven't gone over that you want to discuss? Let me pause here. This moment is very important, because after everything is explained, this is where families finally get the chance to process, ask, and understand. And many times, this is when the hardest questions come out. She continues, if I haven't talked to the family about what code status they are, meaning, are they full code, are they DNR, or do they have mortuary plans, I always try to feel out those things to see how prepared people are. Let me explain this carefully. This is where conversations become very real. Topics like resuscitation, end-of-life decisions, and planning ahead are not easy, but they are necessary, and hospice creates a space where these conversations can happen with guidance and support. She continues, I always say something like, we all have an end-of-life journey, and we know through the diagnosis that you have that yours is coming soon. We don't know when. Is it 6 months? Is it 8 months? Is it 3 months? We don't really know. But what I do know is the more we can prepare you, the better things will go. So do you have any questions about that? Do you want to know what to expect? Let me explain this deeply. This is not about predicting exact time. It's about preparing emotionally and practically. And what she's saying is that preparation brings peace, clarity and less fear. She continues, "My point in saying all this is because I say it like that. It gives the patient and the family an opportunity to ask hard questions. 9 times out of 10, people are happy that someone is finally talking about it. Although it can feel uncomfortable, it's always good to talk about what to truly expect with your specific disease." This right here is powerful. Many families avoid these conversations, but when someone finally opens the door to talk about it, it often brings relief instead of fear. She continues, "If your hospice nurse is not doing that, which they probably will because that's what we do, but if they're not, you can always ask. You can always say, what can I expect specifically with my disease? What symptoms can I expect, if any, and how can you help with those? Let me explain this clearly. Families are not powerless in this process. They can ask questions, request clarity, and be active participants in the care." She continues, "So that's it. That's what you can expect at a hospice admission. Please feel free, if you're experiencing this, to ask all the questions you want during that hospice admission. And I always remind people that at the end of the day, all you have to do is remember to call us. Remember to call us if you need anything. We are here to support you." So, you are officially signed on to hospice. You will start seeing your team in the following days. And please, just remember to call us if you need anything. Let me close this part for you. What Nurse Julie has just done is walk us through the entire hospice admission process from start to finish. And what you should take away from this is that hospice is not chaotic. It is structured, supportive, and deeply intentional. Now we're going to move into the next professional, and this is where things get even deeper. Because now we're going to hear from someone with nearly 2 decades of experience working directly with families through this transition. Nurse Maria Thompson, 18 years in hospice care. Let me explain who she is before I share her words. Maria Thompson has spent nearly 20 years working with patients in their final stages of life, both in home settings and hospice facilities. Her experience is not just medical. She has witnessed the emotional transformation that families go through once hospice begins. Now listen closely to what she says. Maria Thompson explains. Maria Thompson has spent nearly 2 decades working directly with patients in their final stages of life, primarily in home and inpatient hospice settings. Her experience has allowed her to witness not only the medical side of hospice care, but also the emotional transformation families go through once care begins. Let me pause here. This is important because she is not just talking about procedures, she is talking about human experiences, emotions, and transitions. We're just getting into her perspective, and there is a lot more depth coming. All right, let's continue. And now we're stepping deeper into something many people don't expect when hospice begins. Before I continue with Maria Thompson's words, let me explain this to you clearly. What she focuses on is not just the medical side, but the emotional shift that happens for families. This is something that often goes unnoticed, but it can completely change how people experience this stage of life. Nurse Maria Thompson continues. She explains that the admission process itself is designed to bring clarity and relief, not confusion. When a patient is first admitted, the hospice team conducts a comprehensive intake assessment, which includes reviewing medical history, current symptoms, medications, emotional state, and even spiritual preferences. This is not rushed. Maria emphasizes that this step is essential because it shapes everything that follows. Let me explain this part to you. This is where hospice becomes very different from traditional care. Instead of rushing through appointments, hospice takes time to understand the full picture of the patient, not just their illness, but their emotions, beliefs, and overall state. And this is what allows the care to be deeply personalized. She continues. She often sees families arrive feeling overwhelmed, especially after long periods of hospital visits or unsuccessful treatments. What changes quickly, according to her, is the environment of care. Instead of constant urgency, hospice introduces a calmer, more controlled approach where the patient's comfort becomes the central focus. Let me pause here. This is one of the biggest transformations. Families go from chaos, stress, and constant emergency situations to a space that is calmer, slower, and more intentional. And that shift alone can bring a sense of relief that many people didn't even realize they needed. She continues, Maria also highlights that pain management is proactive, not reactive. Rather than waiting for pain to become severe, hospice teams anticipate symptoms and adjust medications early. This may include pain relievers tailored to the patient's condition, medications for anxiety or restlessness, and support for breathing difficulties. Let me explain why this is powerful. In many cases outside of hospice, pain is treated after it becomes unbearable. But in hospice, the goal is to prevent that suffering before it even begins. That's what she means by proactive care. She continues. She adds that families are taught how to recognize subtle changes in their loved one's condition, which helps them feel more involved and less helpless. This part is very important. One of the hardest feelings for families is helplessness, not knowing what is happening or what to do. Hospice changes that by educating and empowering families so they feel more in control and more connected. She concludes, what I see most often is a shift from fear to understanding. Families begin to feel like they can finally breathe. Let that sink in. From fear to understanding, from panic to calm. That is one of the most powerful transformations hospice can bring. Now let's move into the next perspective, and this one is from a physician, which gives us a deeper look into the medical decision-making side of hospice care. Dr. James Patel, palliative care physician, 5+ years experience. Let me explain who he is. Dr. Patel has worked extensively in both hospital-based palliative care and hospice transitions. His role is often to help patients and families make the decision to enter hospice care, which is one of the most difficult decisions they will ever face. Now listen carefully to what he explains. Dr. Patel begins. He explains that one of the most important aspects of hospice admission is understanding eligibility and timing. Many people believe hospice is only for the final days, but in reality, patients can benefit from hospice much earlier than they expect. Let me explain this clearly. This is one of the biggest misconceptions about hospice. Many people wait too long, thinking it is only for the very end, when in reality hospice can provide months of support, comfort, and improved quality of life. He continues. He carefully evaluates disease progression, such as advanced cancer, heart failure, or neurological conditions, along with functional decline, difficulty walking, eating, or performing daily tasks, and the frequency of hospitalizations. What he is describing here is how doctors determine when hospice is appropriate. It is not just about diagnosis, it is about how the illness is affecting the person's ability to live daily life. He continues, Dr. Patel emphasizes that hospice is not about giving up on the patient. It is about redirecting medical goals. Instead of focusing on curing the illness, the focus shifts to reducing physical suffering, enhancing emotional well-being, and allowing patients to spend meaningful time with loved ones. Let me pause here because this is powerful. Hospice is not the end of care. It is a different kind of care. It is about choosing quality of life over aggressive treatment when that treatment is no longer helping. He continues. He also explains that many treatments are not abruptly stopped, but are reassessed. For example, some medications may be discontinued if they no longer provide benefit, while others may be introduced specifically for comfort. This is important to understand. Nothing is done blindly. Every medication, every treatment is evaluated based on one question. Is this helping the patient feel better? He concludes. A key point he makes is that prognosis is not exact. While hospice is generally recommended for patients with a life expectancy of 6 months or less, some patients stabilize or even improve under hospice care. When pain is controlled and stress is reduced, the body often responds in surprising ways. Let me explain this final part. This is something many people do not expect. When pain is managed and stress is reduced, some patients actually live longer or improve in certain ways because the body is no longer under constant strain. We are building a full picture now, from the admission process to emotional transformation to medical decision-making. Next, we are going into the day-to-day reality inside the home, which is where things become even more relatable and practical for families. All right, let's continue. Now we are moving into one of the most relatable and practical perspectives for your audience. Up to this point, we have talked about admission, emotional shifts, and medical decisions. Now we are stepping into what daily life actually looks like once hospice begins inside the home. Nurse Angela Brooks, home hospice specialist, 12 years experience. Let me explain who she is before we go into her words. Angela Brooks has spent over a decade working directly in patients' homes. That means she is not just seeing things from a clinical perspective. She is seeing real families, real environments, and real day-to-day challenges. Her role is all about helping people feel safe, supported, and capable in their own space. Angela Brooks explains. She explains that once hospice begins, the patient is assigned a full interdisciplinary team, which typically includes a primary nurse who manages care, a hospice aide who assists with bathing and personal care, a social worker for emotional and logistical support, and a chaplain for spiritual guidance if desired. Let me break this down for you. What she is describing is a complete support system entering the home. This is not just medical care. This is help with daily living, emotional support, and even spiritual guidance if the family wants it. She continues. Angela details how quickly support systems are put in place. Within a short time after admission, medical equipment such as hospital beds, oxygen machines, or wheelchairs are delivered. Medications are organized and often provided directly, and emergency contact lines are made available 24/7. Let me explain why this matters. Everything is set up quickly and efficiently because hospice understands that time and comfort are critical. Families are not left waiting or wondering. Support begins almost immediately. She continues. She stresses that families are never expected to manage everything alone. One of her key roles is to educate caregivers on how to safely administer medications, how to reposition patients to prevent discomfort, and how to recognize signs of changes in condition. This part is very important. Caregiving can feel overwhelming, especially for people who have never done it before. What hospice does is teach and guide, so families do not feel lost or afraid of making mistakes. She continues. Angela also explains that hospice care is flexible. Visits may increase if the patient's condition changes, and additional support can be arranged quickly. Let me explain this clearly. Hospice is not rigid. It adapts. As the patient's needs change, the level of care adjusts in real time. She concludes. We step into their world, not the other way around. Our job is to make the home feel safe and supported. That line right there says everything. Hospice does not force patients into a system. It enters their world and supports them where they are. If this message touched you in any way, please like, share, or leave a comment below. You never know who might need to hear this today. Now let's move into a broader and deeper perspective. Someone who oversees entire hospice programs and focuses on the big picture of care and dignity. Dr. Robert Chen, Hospice Medical Director, 20 years experience. Let me explain who he is. Dr. Chen has over 20 years of experience and oversees hospice programs, meaning he ensures that every patient receives care that is not only medically appropriate, but also aligned with their personal values and wishes. Dr. Chen explains. He explains that hospice care is deeply rooted in the concept of dignity and individualized care. Each patient's plan is tailored not only to their medical needs, but also to their personal values. Let me explain this. This is where hospice becomes deeply human. It is not just about treating symptoms. It is about honoring how a person wants to live their final chapter. He continues. For example, some patients prioritize being alert and communicative, even if it means experiencing mild discomfort. Others prefer stronger pain control, even if it causes drowsiness. This is very powerful. There is no one-size-fits-all approach. Each patient gets to decide what matters most to them: clarity or comfort, awareness or rest. He continues. Dr. Chen works closely with families to ensure these preferences are honored. He also explains that hospice includes advanced care planning, which may involve do not resuscitate decisions, living wills, and discussions about the preferred place of care. Let me explain this clearly. This is about planning ahead with intention. Instead of leaving decisions to chance, hospice helps families prepare and make choices that reflect the patient's wishes. He continues. Another key aspect he highlights is holistic care. Hospice addresses physical symptoms, emotional needs, and spiritual concerns. This is one of the most important ideas. Hospice is not just medical. It is holistic. It treats the whole person, including their fears, beliefs, and emotional state. He concludes, Our responsibility is not just medical, it is human. We care for the whole person, not just the illness. Let that sink in. This is the core of hospice care, human-centered care. Now we move into the final perspective, and this one brings everything together, especially for families who are navigating uncertainty, stress, and emotional weight. Nurse Danielle Ruiz, Hospice Case Manager, 10 years experience. Let me explain who she is. Danielle Ruiz is responsible for coordinating everything, including communication between the team, the patient, and the family. She ensures that nothing falls through the cracks. Danielle Ruiz explains. She explains that one of the most important parts of hospice admission is setting expectations clearly and compassionately. Families often come in with uncertainty, and her role is to help them understand both the process and what lies ahead. Let me explain this. Clarity removes fear. Her job is to make sure families are not left guessing. They understand what is happening and what to expect. She continues. She provides detailed guidance on what physical changes may occur over time, how energy levels and appetite may decrease, and how to interpret signs of progression. This is crucial. When families understand what is normal, they feel less panic and more prepared and grounded. She continues, Danielle emphasizes that these changes are natural, not something families are causing or failing to prevent. Let me pause here. This removes one of the heaviest burdens families carry, guilt. She continues. She also addresses the emotional side, noting that caregivers often experience guilt, fear, and exhaustion from prolonged caregiving. This is real. Caregiving is not just physical, it is emotional and mental. Hospice recognizes that. She continues. To support this, hospice offers counseling services, respite care, temporary relief for caregivers, and bereavement support that continues after the patient passes. Let me explain this clearly. Hospice does not end when the patient passes. Support continues for the family, helping them process grief and adjust. She concludes, we walk with families through every stage, not just the medical journey, but the emotional one as well. That brings everything together. Final reflection for your audience. Let me speak directly to your audience. When you take everything these professionals have shared, hospice becomes something very different from what many people expect. It is not about giving up. It is about a structured and thoughtful admission process, a shift from cure to comfort, a full team supporting both patient and family, guidance through physical, emotional, and spiritual changes. Hospice is about dignity, peace, and meaningful time. And the most powerful truth is this: hospice does not take away hope. It redefines it. If this message touched you in any way, please like, share, or leave a comment below. You never know who might need to hear this today.